Thank you very much, Dr. Christine Ondoa. I was so used to addressing her, Honorable Christine Ondoa, for quite some time. I don't know whether she's pleased that now people don't have to say honorable every time. May I ask you to stay here and then also to invite Jesse to come over. We have about 10 minutes. We'll have very quick comments, responses to our two keynote speakers, and then it's very rewarding that Dr. Christine Ondoa has given testimony that the work that UNAS is doing has actually been used by government and has also affected some of the interventions. She talked about immunization that had gone, down. So I think as UNAS, we have to pat ourselves on the back. And also for our promoters and supporters, it is an indication that you're investing in the right direction. Now, I have to say that because I'm the treasurer for the Uganda National Academy of Sciences, so people have to know that the investment is paying off, and they should invest more. So now, can we have quick comments, questions, clarification from members? I'll ask my colleagues to take around the mics.
Good morning. My name is Silvia Pasti and I'm from UNICEF. I have just a comment on the first presentation on what can we do and the way forward. I think that besides focusing on adults or women, even if they start being women at the age of 15, I think that it's important that we start with children and the way that they are socialized, the way that they learn the roles of being girls and boys, and also changing their aspiration and also expectation. And I think that maybe that was missing in the way forward that was presented, and I would like to hear the comment on it. Thank you.
Good morning to you all. I also had one contribution on the way forward. I thought that maybe it would be important if we can also try to link IPV to the acute injuries that arise out of it, because most people might only look at maybe mental health, but when a woman is beaten, she might break her limb or sustain a black eye or something like that, and it's also going to impact on their own health. So maybe we can also look at ways that we can try to link acute injuries to IPV as a way of moving forward to curb it all. Thank you.
Could you say who you are and where you're coming from, please?
I'm called Magola Joseph. I'm a student at Makerere University where I'm pursuing my master's in public health.
Thank you very much. My name is Florence Vuruva, and I'm the Executive Director of the National Community of Women Living with HIV in Uganda. It is abbreviated as NACOLA. Thank you very much for the presenters. And from the first presenter, there was something to do, mentioned about capacity building, which I think I concur with you that there's a lot of limited capacities among women, especially at the grassroots. And this actually adds their vulnerability to what is actually happening. My next concern is with Dr. Ondoa's presentation. It is clear that the statistics are there that women are more vulnerable. And I'm just wondering, as the Director General, what is it that we need to do when it comes to financing of women's projects? We look at women as a resource, as we have been saying, and here you are, they are really being vulnerable. They are butchered, they can't talk, the laws, the cultures are so bad, all targeting the women. How do we make sure that these women have the resources also to stand up and talk for themselves? You mentioned something to do with poverty, which is really clearing at the community level. Women are really depending on their spouses. How do we make women empowered so that they can stand up and support their children and equally support themselves? Thank you.
Good morning, everyone. I'm Esther from Kenya, Parenting in Africa. I want to echo what the lady from UNICEF said about us focusing on children, because IPV has a direct implication on the children. And even as we did our study, I'm wondering if perhaps we got statistics on the relationship between the perpetrators of IPV and their socialization when they were young. I think that is key, because it is said that children see and the children do. So perhaps it could have been very important to know how the spouses in their young age, when they were growing up, if they were brought up in setups where there was IPV, if that has an effect on how they handle their spouses. Thank you.
Thank you. Can I shift to this side?
Good morning, everybody. My name is Rose Nyakato. I work for Care International as a Social Protection Program Coordinator based in Gulu. Thank you, our dear presenters. My question goes to Jessie. In the way forward, you talked about safe exit plans and space. And my idea here is that how do we help our GBV survivors get this safe exit within their communities? In some districts, there are some GBV shelters that have been established. A case in point is Masaka and Lira. But my concern here is sustainability. How do we sustain this? Because this is really very, very important that the survivors get safety. To me, I think it's the biggest priority. Thank you.
Can I ask the keynote address speakers to respond to some of these comments?
I appreciate all those questions. I think they're very valuable, and I also think the comment was spot on. One of the things that you'll remember is when I started off, I said I was being agitative, and I expect that most of these are going to come from all of us rather than myself. But I'll try and maybe attempt at answering. With a reference to children, I agree with what you're saying, but one of the things that I might have not said, which I think will be said later on when they talk about violence against children and what interventions might work, is that when I did talk about community interventions, I did not do target segmentation. So it is not specific as to what type of intervention each and every group will need. And that is where I think we'll need to, as a group, to start thinking about where do children fit, what are the norms, what are the socialization messaging that is required for us to have healthy adults who do not see that the way forward is to perpetrate violence. So again, that brings us back to the team. I'm also very cognizant about IPV and acute injuries. It's something that I did not discuss in great length because I looked at the health sector overall. If I talk about screening, it does not mean that I'm screening for psychological. I'm screening for physical, psychological, and sexual. And the care that follows through depends on what it is that woman is subject to. I would like to say that taking into account the key references that I thought I should share with people here, which is WHO as well as the DHS, all of them lend themselves to saying women who are subject to intimate partner violence say that they do not have good health. So the fact that they themselves perceive that they are not in good health means that they are looking at their own physical, sexual, and emotional health and making interpretation as to what it means. So injuries, while very important, will fall into the domain of any interventions that we're going to be doing in the health sector. With reference to the issues related to risk and causal pathways, those I did say, as we stand, we don't have enough information that allows us to be able to say a lot, at least in the region. But outside the region, there's some examples in small-scale studies that have shown success. There is opportunity for us to learn from the outside and see to what extent those are going to be able to be implementable within our settings, because we should try and see that we cannot take something as a wholesale, remove it from one environment to the other and expect that it's going to be working. It is important for us to sit and think and adopt and pilot and make sure it works before we go to scale in that particular situation. The exit plans and spaces, I agree with you. They're not sustainable, but they're needed. And we need to find better ways in which safe exit plans and spaces are not necessarily units that we build and get people to. It can be something else. We need, again, to be creative and innovative and allow ourselves to look at what will it look like. A good example, for instance, is taking, for example, the Raising Voices program that is in Uganda. Tanzania Kivulini came and learned about this model and started using it. But when you look at the WHO multi-country study, the first point of contact that I would not say a victim of violence, but a person who's subject to violence usually accesses is their local leader. It's not the police, it's not the healthcare setting. So what is it that we need to do as a community to make sure that this woman remains safe, rather than building, I won't call them white elephants, but it looks like that.
Thank you, Kristen.
Thank you. I think I had only one question about financing women's projects to empower them in order to reduce poverty. I totally agree with this. First of all, our HIV prevalence in the country is also associated with poverty. And the more we empower the women and the vulnerable groups, the more they are able to say no to unprotective sex or risky behaviors. Also, one of these studies that I quoted found out that some women still remain in abusive relationships because apparently they have nowhere else to go. So even after violence against them, they just opt to remain. But assuming that they're empowered and, they can go and rent their own place and fend for them and their children. It will go a long way in reducing the violence and hence their consequences. Consequences on them and also consequences on their children. So I really agree with that, and this is one of the issues that we're looking at policy level now. One of the bills that are being debated includes some of the sections around this, and hopefully it will come to a better conclusion and we'll have that policy and law in place. So this is, I think, all I can say about this for now. Thank you.
Thank you. Can I ask Dr. Mbwambo to say something about the same question?
Right. Financial empowerment of women is a double-edged sword. We don't know whether it's going backwards or forwards. And in a small study that we did, Charlotte and Samuel, who are in this room, will tell you that you may empower women and expect that she won't be subject to intimate partner violence. Actually, it may worsen it. And we did find that in a small qualitative piece of work that we did in Bear, comparing that to Dar es Salaam, which does mean that we need to learn more about the dynamics that are associated with giving an individual ability to earn money themselves while they're in a partnership, rather than giving the family the package for them to be able to work together and look at it as an ownership of the family. Otherwise, we're going to put women in more serious circumstances than is the case. But this is, again, subject to research, because this is a small study. It can't stand on its own. It can't say that this is the golden rule. But what we're going to have to do is prove it or disprove it, so that we know whether financing women only is going to be beneficial. However, when people have done cash transfers, there has been something that has happened, but what I've heard is it works even better for women who are not in partnerships, but women who are members of key affected populations or who are in female-headed households. So I'm not very sure. I think it is something that we need to be looking at very closely in the region, so that we just don't jump in and then it doesn't work out.
Thank you very much. Our keynote presenters, as is expected of keynote presenters, they set the stage. And so a lot of issues that have been raised by them are going to be echoed in the various sessions of this workshop. So I hope that you've been taking good notes. And for the session presenters, you've also been taking good notes so that you can orient your presentation to reflect and answer some of these questions. In the room, we have a lot of persons that come with a lot of experience. I saw Tina Musuya there, you know, shaking her head in the affirmative about the complexity of empowerment of women when we're looking at issues of intimate partner violence, because a lot of times we think that, you know, give them economic empowerment, educate them, and all these things. And, you know, we're sort of taking them out of context and sometimes making it worse than before. But as Jessie has said, these are areas that we need to reflect on. Dr. Christine Ondoa raised an issue that I think we also need to constantly reflect on. Uganda has been known to have very good and very many policies. And the question of enforcement of laws, and therefore the science of IPV law enforcement needs also to come on the table as we're discussing. So if we're looking at these interventions, what makes them work? How can we enact laws that will eventually get implemented or enforced becomes an issue. So beyond providing the magnitude and scope of the problem, we also need to engage in how we can reflect on this and how we can, enforce those very good laws that we're coming. She also mentioned, and I think in reading what was contained in the monitor of today, she invited us to the responsibility and place of the media. And so I think as we're discussing, we also need to reflect on some of these issues. So I think on that note, I would like us to break for tea and coffee, or for a health break, so that we can then come back to our first session. I want to request you and ask you to join me to put our hands together and thank our keynote presenters.